We start with 41 Action News reporter Andres Gutierrez, who explains what went into creating this vaccine.
The way of getting a COVID-19 vaccine is still the same, but it's what's inside the vials and syringes that's groundbreaking. The Pfizer vaccine doesn't use the virus itself. Instead, it was developed using messenger RNA.
The new way to induce the immune system to ramp up in order to fight a specific protein that is on the coronavirus.
It's the first time the FDA approved an mRNA vaccine.
It really goes to show how science well done can really ultimately get us out of a very, very difficult situation we're in with this pandemic.
Though it took months, not years, to develop, Dr. Darren D'Agostino with Kansas City University points out no one cut corners. Instead, scientists worked smarter on a technology they've used before.
And so multiple things that had to happen previously in a very linear way that added time were occurring in parallel so that the data could be analyzed in real time and actually move through the process much quicker.
The vaccine is only half of the solution. Getting vaccinated is the other.
It would be a great tragedy if disparities actually worsened because the people who could most benefit from this vaccine won't take it.
Though the vaccine isn't widely available just yet, the university is coordinating with local health departments to have their medical students help with inoculations in our community.
We'll be setting up groups, potentially tents. It might be in schools. We don't know how that's going to work. That'll be up to the logistics people who are putting it together.
Many public health experts expect a flashback to the long lines of the 1950s and 60s after the polio vaccine was released. This time for a vaccine that's making history in modern medicine. In Kansas City, Andres Gutierrez, 41 Action News.
And Dr. D'Agostino told us early evidence shows the vaccine can provide 8 or 9 months of immunity. And while the vaccine is a great first step, getting back to normal won't be instant.